Welcome those who are just beginning to come back in. If you could find your seat, we'll get started here with this next panel. We do have the poll results, so I presume it's working. So you can see the poll results from the first session. The question being, do you support public funding for charter schools? And as you can see in our very unscientific poll, we had 49 text in, yes, they do support, and 29 text in that they do not. We will have a poll again at the end of this session, and I have to tell you, this, for me, is a great session, and I'm just going to listen to the three of you all talk, because this is really what drove my interest. I'll be very honest with you on a personal level. When I was 18 and registered to vote, what drove my interest in public policy and politics really were budget issues, and I have to tell you, we have a panel here that is just an incredible group of people, and I promise you we're going to walk away learning something. As I did with the first panel, let me lay just a little bit of context for you for this topic, kind of where we are today in terms of public policy. And again, this is all constructive, as I mentioned with the questions, and thank you for the questions you submitted. Nothing is intended to be political. We're focusing on policy, not the actors behind the policy. We did learn a little bit from the questions that came in the first session. We're going to try to move more quickly through some of the questions and just have one or two of the panelists answer the questions. I would also ask, for those who submit questions, keep it focused on questions. Unfortunately, we won't have time to kind of go through the comments or reactions to some of the statements, only the questions. So budget reform is the topic of this panel, the larger question being the federal budget. Let me lay a little bit of context, and I'm going to use a broad brush on the numbers, and I know Dr. Holtz-Eakin's going to get very granular and refine the broad brush that I'm going to paint with, but let's talk very briefly about deficit, surplus, and what that means and where we are today. When you hear the term deficit, that usually refers to your annual deficit, and it's true in any business, it's true in your household, it's true in government. What is revenue compared with outlays? And if there's more revenue, we have a surplus. If there's more outlays, we have a deficit. The deficit is the annual number. The debt is the cumulative number since the beginning of our republic in 1789. And to provide some perspective, in 2008, after 220 years, roughly, of the history of our republic, we had accumulated roughly $10 trillion in debt over 220 years in total debt. In the next 2 years or so, we will likely hit 20 trillion. So understand the growth curve we are on. Now, part of it, and I know our panelists will discuss, is a result of the economy of the past 6 years, and we are seeing where deficits, annual deficits spiked significantly in the past few years. They are beginning to come down, but we are still in a deficit, and we are still adding to that debt in a very historic way. The question obviously then becomes, do we achieve balance through additional revenue or through additional cuts? And there's economic theory behind that discussion that people could talk about for ages. As we talk about federal programs, I want to give you just a thumbnail lesson, because this is a very important concept when it comes to the federal budget. The federal budget is divided essentially into two silos, roughly. One is discretionary spending, and one is mandatory spending. Mandatory spending is kind of the easiest one to think about. Mandatory spending is spending that's enacted by law. Congress and the President don't have the discretion each year to decide if they're going to spend $1 or $100. What are mandatory spending programs? Social Security, Medicare, Medicaid. It's mandatory because if you think about how those programs are set up, it says for you as an individual, if you have worked 40 quarters, 10 years, then you are entitled to this benefit. Congress can't decide next year we're only going to spend $1 on Social Security instead of $100. That is a statutory spending item. It is mandatory. Discretionary are what you think of the basic functions of government, from the Department of Defense to transportation, to the environment, to education. Those are programs that Congress and the administration each year can determine where they want to shift priorities. So as we saw, for instance, during the conflicts of the last 10 years, additional money was spent on defense because that was the discretionary decision of the administration and the Congress. Why does that matter? It matters for a couple of reasons, because the ability to cut, if we're looking at just the savings side, on the discretionary side is an annual process. On the mandatory side requires significant reform. When you hear the term entitlement reform, it would require changing the law to cut entitlement spending or mandatory spending for Social Security and Medicare. In other words, the government would have to change the age of eligibility for benefits from 67 to 69 to 70, or perhaps means test. That would be a function of the law. And I also want to provide, and I think Dr. Gordon might have some more detail on this, but a little bit of perspective on how the pie chart comes in on mandatory versus discretionary, because this is very important. Prior to LBJ and the growth of mandatory programs, Medicare, et cetera, if you go back about 50 years, mandatory spending was roughly 30% of our budget. And I apologize, I'm glossing over this because I know you all are the experts. It was roughly 30% of our budget. So 70% of our budget was discretionary, defense, transportation, et cetera. A lot of room to prioritize. As a result of the growth of Medicare Social Security expenses, where we sit today is if you take just Medicare, Social Security, Medicare, and interest on the debt, which is mandatory, that now represents in the high 60s, pushing 70% of our federal budget. It's almost flipped from 50 years ago. And by some analysis, in our lifetime, mandatory spending, Medicare, Medicaid, Social Security, and interest on the debt, will eat up virtually every dollar that our Treasury takes in. So what does that mean? It means the functions of our government on the current path that we're at, the functions of our government would have to be funded entirely by debt, from defense to transportation to education to what it might be. So it raises a very pressing question. If you consider the growth in our overall debt, again, in the last 10 years, having doubled what it took 220 years to build, as well as this crash course we're on with mandatory spending consuming all of our Treasury dollars, we are in a position where we have to face this as a nation. And there are multiple answers. Some say cut, some say raise revenue. And that's why we have the policy discussion today and our three panelists. Let me introduce, as I did before, the three panelists, and then we will open it up for their opening comments. We'll start for introductions with the Honorable Jim Davis, a former member of Congress, serving in the U.S. House from the Hillsborough region from 1997 to 2007. In 2006, Jim was a Democratic nominee for governor of the state of Florida. Prior to that, serving 8 years as a state representative in the Florida House, including serving as majority leader in 1995 and 1996. Please welcome the Honorable Jim Davis. To Jim's left is Dr. Joshua Gordon, the Policy Director of the Concord Coalition, a nonpartisan grassroots organization dedicated to educating the public about federal budget issues. He was born in Seminole. Josh has a PhD in political science from the University of Florida, where he wrote a dissertation on the budget process and the House Appropriations Committee. He is an adjunct professor at the George Washington University Graduate School for Political Management. Please welcome Dr. Joshua Gordon. And to his left is Dr. Douglas Holtz-Eakin, president of the American Action Forum. From 2003 to 2005, Dr. Holtz-Eakin was the director of the nonpartisan Congressional Budget Office. Dr. Holtz-Eakin was also the Paul Volcker Chair in International Economics at the Council on Foreign Relations. Please welcome Dr. Douglas Holtz-Eakin. And we will begin this panel with opening comments from Dr. Gordon.
All right, thanks. All right, I have some slides to show you to describe.
The budget panel requires slides.
Of course. That is how we do things in the budget community. All right, so let's start with the next slide. This shows you the history of the debt and our projected future. As Congressman Jolly said, you have from 1790 or so to where we are now. You can see that the really large bump was right after World War II. We had the largest debt. We like to measure debt as a share of the economy because that gives you a sense of what we can afford to be carrying based on how much economic activity we have. So we had a debt of over 100% of the value of the economy at that point. And then it came down after World War II. We had increased economic growth. We had fairly responsible fiscal policy. And then you can see right before the recession in about 2008, it was at about 40% of GDP, which really is our kind of post-World War II historic norm. And then with the recession, you tend to automatically have large deficits during a recession. People earn less, so they pay less in taxes, or they're not working, so they're not paying taxes. So revenues fall pretty dramatically. And then there are some spending programs that increase automatically based on the state of the economy. And really, that's what we call kind of the cyclical deficits that rise and fall based on the economy. So we had this really large run-up of the debt, both because of the economic factors and because of spending and revenue policy on Capitol Hill. And really, so now we're at about 74% debt as a percent of GDP. And this is where we're on kind of the precipice of what we're going to do for the future. Because for the next few years, that debt is projected to remain at about the same level. And then over the long term, you can see it rise very dramatically, much higher than our World War II levels. But the Congressional Budget Office that Doug was in charge of projects that large increase in debt, and yet there's no assumption that we're going to have another large war like World War II. They actually assume steady economic growth throughout that period, and yet you still have debt growing much more quickly than the economy can keep up with. And that is really what we call the long-term fiscal challenge. The problem is when your debt grows so much more quickly than the economy, it actually begins to act to slow economic growth, to lower standard of living, and to really reduce the fiscal flexibility that future generations have to determine their own economic and policy choices. And that's really what we're most concerned about. Okay, next slide. So this shows you why the debt is growing as quickly as it is, more quickly than the economy. Because of growth in really four main areas of the budget: Social Security, Medicaid and the Affordable Care Act, exchange subsidies, and Medicare. Those three categories of programs are the ones that are growing more quickly than the economy. This is your mandatory spending programs that Congressman Jolly spoke of. And then interest on the debt is growing much more quickly than the economy because you have growth in those spending programs and your revenues are not keeping up with them. So you're running larger and larger deficits every year, and that leads to more interest costs on the debt that we're accumulating. All other spending programs of the federal budget are projected to shrink pretty dramatically as a share of the economy going forward. So this is your main budgetary pressure. You don't have revenues that are keeping up with really fast growth in the big mandatory spending programs. Okay, the next chart. That all other spending, the discretionary spending, the spending controlled annually by Congress, which, as Congressman Jolly said, is shrinking as a share of our overall budget, these programs are actually projected to go much lower than they've ever been in history. They are growing much more slowly than the economy, much more slowly even than inflation. And so you have them right now lower than their average over the last 40 years. years and projected to go lower than they've ever been. And so when members of Congress talk about these annual appropriations, you talk about spending on foreign aid or education or transportation. These are the programs that are being squeezed because of the growth of the mandatory spending programs. And these are also really the only programs of the federal budget that increase economic activity, worker productivity, investing in research and development, infrastructure. Those things are the building blocks of our economy. And so if we squeeze those programs, that just compounds our fiscal problems going forward because the economy, again, can't keep pace with our rapidly growing debt. All right, the next chart. There's one other area of spending worth mentioning, and this is a little bit of a tricky concept, but we actually spend money through the tax code, through all of those deductions and special provisions and rate changes and exceptions and tax preferences. A lot of times we call these loopholes. These are actually very large spending programs of the federal budget. So this chart is a little bit difficult to understand, but those red bars are all of the money that we take in through the individual income tax and the corporate income tax. The blue bars are the money that the government devotes to encourage behavior through the tax code, which really economically is the same thing as if we were spending money through a spending program. We're giving out almost as much in revenue as we're taking in through the individual income tax and the corporate income tax. And so we'll talk a little bit about tax reform, and this is one of the reasons why there's so much talk about tax reform, because we have this incredibly complicated tax code that is really spending a lot of money that doesn't go through the trade-offs of the annual appropriations process, and those things kind of grow on autopilot just like the mandatory spending programs are. So this kind of lays out the basic structure of our federal fiscal challenge, and we'll talk about more things as we go through.
Thank you, Dr. Gordon.
Sure.
Dr. Holtz-Egan.
Thank you. First of all, thank you for the invitation to be here today, and thanks to St. Petersburg College for this fabulous setting. The last time I did a panel like this with Josh, it was in January in Iowa, and I am much happier to be here today. If you ever serve as director of the Congressional Budget Office, it is your role in life to be the voice of doom thereafter. Let me try to instead say that there's reasons to be optimistic about this, and here's the case to be made. If you want to do budget reform, I think it's pretty clear from the conversation so far, you have to do entitlement reform. That is the #1 thing. And what do you get if you do it? Well, you get the chance to avoid the debt spiral and get better economic performance. I don't know how fast the U.S. is growing right now. It's something like 2.5%, maybe 2.75% per year at best. But the long-run projection out of the Congressional Budget Office is 2.1%, which means these are the good times. And it's pretty hard to get your head around the idea that this is the good times, because it's not that good out there right now. And so we have the opportunity, if we do get the entitlement programs under control, to not have the debt, to grow more rapidly, as Josh said, in the out years. And that's everything in America. Historically, after World War II, the standard of living doubled every 32 years. That meant in a working career, you could imagine sending someone to college for the first time. You could have them, buy a vacation home or a boat, or whatever it was. It was within the realm of possibility that if you worked, you could double your standard of living. At 2.1%, the standard of living doubles every 75 years. And that's not what we want to leave behind to our children. We want to give them the same opportunity that we've historically had to leave behind a strong economy. So that's an opportunity in entitlement reform. It's also the opportunity to take care of our national security, not crowd out the defense budget. Take care of all the things the founders envisioned as the role of government, the infrastructure, basic research, things like that. And quite frankly, preserve what should be options in a democracy. It strikes me as fundamentally unfair to lock in how we're going to spend all our money now and not have my kids have an option 15 years from now to spend it differently. And so that's a core American value, to be able to change priorities through the ballot box, and we're taking that away. So we can fix that. I think that's a good thing to do. But most importantly, we can get better programs. It's not like Social Security is a whiz-bang winner. The plan for Social Security, the one that allows the actuaries to say it's solvent and the trustees to issue the reports, is to cut benefits 25% across the board 20 years from now for people in retirement. I will stipulate that's a rotten plan. I mean, this is the United States of America. We're the largest, strongest democracy on the planet. We can do better with the pension system. Medicare, same thing. A lot of money going into Medicare. It's $300 billion of these trillion-dollar deficits we've seen recently. And there's universal agreement that our seniors do not get the quality of care that we are capable of delivering for less money. So we should make these programs better, because we should have a social safety net in the 21st century that we're proud of. And we can do that if we reform these programs. Now, the standard response is always like, no, the politics is awful, no one's ever gonna do this. And I'll stipulate that that's been true, but I think things are changing. If you look at the numbers that Josh lays out, when you get to 10 years from now, say 2024, you'll see that there's a $1 trillion deficit, and $800 billion of it, almost all of it, is interest. So we're borrowing to pay interest on previous borrowing. It's the new credit card trick. That's unacceptable. So what happens politically? Well, if you're running for president in 2016, and basically everyone is, I mean, anyone here? I mean, must be. There's going to be someone like Josh in the room who's going to say, you know, when you're elected, your first term will be 2020, its second term will be 2024, and 2024, the apocalypse happens. So we might want to think about that. And so, as a matter of just pure naked political interest, the next presidents are going to have to think about this. And they're going to have a political interest in not presiding over this kind of a decline. And there will be top-down pressure that'll help people like Congressman Jolly, the Congress in general, to get White House leadership to take on this big problem. Makes their job a lot easier if the President of the United States is saying, we need to do this. And there's going to be bottom-up pressure as well. These defense folks are not going to go quietly, right? I mean, the defense community is really upset. If you read the papers, they need more money. And they're making that case now. And the non-defense folks are too. I recently spoke to the Non-Defense Discretionary Coalition, the single worst name ever. But they exist. And they're making the case that they need more money, so they're going to be advocating for changes to these reforms. And so, you know, for the people in this audience, I would say, you know, entitlement reform, that phrase has always sort of carried an implicit threat when it's used in political discourse, but I don't think that's right anymore. I think it's an opportunity, it's certainly a necessity, and it's something you're going to hear more about, not less, in the years to come.
Thank you, Dr. Holtz-Eakin. Mr. Davis.
Thanks for inviting me, Congressman. It's good to be here. I still believe politics is about ideas. It's a pretty wretched time to follow the day-to-day ups and downs. And so I think this is really key to you're doing your job well and all of us helping all our representatives do our job well. Last time I was on a panel with Doug, he was testifying in front of the House Budget Committee I served on. Congresswoman Castor served in that committee. If you want to serve in that committee, I hope you get good coffee as well. Congressman Dan Miller, who many of y'all remember, served on that committee. And one of the good things about this morning, and what was sometimes a good day in the committee, is when we're operating off the same set of facts. From the vote you put up on the charter schools, that tells me this is a pretty mixed audience politically and ideology, and that's important. If you're a Republican who's willing to support tax increase under the right circumstances, or if you're a Democrat that's willing to support entitlement reform under the right circumstances, or if you're an independent, you're a key player in this debate. Because I agree with Doug, there is a way to find common ground. As a matter of fact, if you've had a chance to look at your iPhone or BlackBerry this morning, you see that Harry Reid announced he's not running for re-election to the United States Senate. Careful, you don't know what comes next. And they're all having a rough time up there. But I make that point because the next majority leader could be Dick Durbin. And before you don't applaud, you need to know Dick Durbin, and Doug will testify to this. Watch carefully when Doug and I agree on these issues. Was a supporter of Simpson Bowles. And he is an unabashed progressive Democrat from Illinois, very close to the president, who believes, as Doug just said, and I do believe too, that we do need to do entitlement reform. So let's put a human face on these numbers a little bit. When I used to do these meetings, David, with the Concord Coalition, I think we used to say that every baby born today at all children's or any of the daycare facilities inherits a debt of about $25,000. I think that number's up now closer to 40,000. I'm sure you know the statistic. So welcome to the world. Welcome to the United States. Welcome to Florida. Here's your bill. Okay. All right, now let's juxtapose that with, I remember going to a factory one time when I was a member of Congress, talking to a group of people that stood up all day and had sore backs, explained to them that maybe we need to talk about raising the retirement age. I'll tell you, these folks had sore backs, but I could still outrun them. That was not a pretty conversation. So you can't make these transitions abruptly. It's unfair. Washington governs by crisis, but none of us are going to plan our personal lives, our pension, our retirement, our family savings by crisis. That's unfair. And so we do need to address this on the front end. The last thing I'll say is that, as Doug alluded to, that one of the prices we're paying for those statistics up there is we're robbing the opportunity to make investments and to give our representatives, Democrats and Republicans, the chance to make choices. Choices in investing in infrastructure. In a growth state like Florida, you pick up the paper this morning, we're now the third largest state in the country. And I'll tell you, those New Yorkers are still getting our tax dollars to build their roads and bridges that are crumbling. That's one example. Another example is the NIH. Congressman Jolly, many Democrats and Republicans, strong supporter of investing in NIH. I think that's a fair statement. That costs money too, but boy, what a powerful investment. And when you're paying interest instead, or you're getting gobbled up in entitlements, you're missing the opportunity to make these investments. That's something that Democrats and Republicans can agree on. So look forward to the discussion this morning.
Thank you, Mr. Davis. One thing I want to point out on the discretionary mandatory side, because I think it was touched on, particularly Dr. Gordon's comments about really the decrease in the discretionary spending, and I know you were doing it as a factor of GDP, but understand, and there was conversation last December about the omnibus appropriations bill. That was a package of the annual discretionary bills. It came out at about $1.1 trillion. It's a big number. But understand that discretionary number 5 years ago was $1.4 trillion. Now that included war funding, what we call overseas contingency. So a lot of that reduction was because of a drawdown in war funding. But understand that, again, just for context, this continued decline in the discretionary spending, including on the investment side when it comes to research, to transportation, and what it might be. Let me ask a question, and again, I don't know if we have the phone numbers that we can put up for texting questions, if we can get that on the screen. So just as we did last time, feel free to text questions or email questions, and we'll get those here in a minute. Let me ask you a question just to kind of, sure.
I just want to emphasize something that's going on this issue of the discretionary accounts. The pressures that were in the charts have been going on for a long time, right? And they've just been pushing the discretionary out of the budget. But what we did recently is actually enact a law that caps them. So now we've not only taken a bad trend, we've made it the law of the land. And we cannot spend more on defense this year unless we change the law. And you can't spend more on non-defense either. So we've locked in a very bad choice, and that's an issue.
So I'm going to add one more thing. I promise you this is going to be a great discussion. In a recent congressional hearing, so the caps that Dr. Holtz-Eakin refers to on discretionary spending affects what you can spend, including in defense. We had all of the senior enlisted service members from the 4 services present to us their budget for the year. The Sergeant Major of the Army, the gentleman that's responsible for all enlisted service members in the Army, made a statement. He said, this year's budget represents the red line for the Army. Past this point, we begin to impact our strength and our ability to defend the national security of the United States. It's a very powerful statement. Now listen, part of the job of Congress, and Mr. Davis knows this, is to provide oversight, to test that theory. Every agency suggests they need more money, but that is the environment in which we're working in right now in Congress. Let me ask a question to push the conversation a little bit. There are some who have suggested on both sides of the aisle that's not really that bad, that it's okay to carry debt as long as we're keeping it within a certain factor of GDP. On a personal level, I think most people in the community across the country, they worry about debt, right? If you have debt on your credit card, that's necessarily a bad thing unless it's good debt that some would tell you, mortgage and whatever it might be. Is debt a bad thing? Should we try to eliminate the debt, or are there consequences? Are we able to just manage the debt? I'll open it to
all right, I guess I can start. I think the thing you said about mortgages to do something important like go to school or...
Right, the term good debt versus bad debt.
Right, good debt. And so right now, our projection, I think on that spectrum would be for bad debt because Social Security and Medicare are very important programs, but they're really consumption programs. That's money that the federal government is spending that just is not being invested for the future. It's being used to fuel consumption, either on healthcare or retirement income. So it's bad debt in the sense that if you are not allowed to have good debt because you have so much consumption-based debt, you lose this borrowing to do investments for the future. That's basically what we're seeing. We're seeing a conversion of the debt to debt that's really just fueling consumption, which doesn't mean it's bad, but it means that you're losing the ability to borrow money to do the investments that you need to have the economy grow in the future. And then, so that's something to keep in mind with how the federal budget is projected to act. The other thing that's worth pointing out is that we're very lucky in the United States to be a very safe investment as an economy and as a country. So other countries around the world, other people saving money around the world, loan us their money and are willing to do it at very low interest rates because we have this still very robust economy, a very large economy, and so that makes it a safe investment. What the concern is that if you have the debt grow more quickly than the economy over the long term, you begin to lose that safety, you begin to lose the ability to continue to borrow, and I think that's the concern. So right now, we've been able to handle the amount of debt that we have as a country because we're still this very safe investment. And the concern is that if you allow that to keep growing, that's when you really begin to have harmful economic effects.
Very good. Well, we're going to try to move through questions because we had a lot we didn't get to last time. So we're going to, Dr. Holtzik, the next question's for you. Where's the greatest opportunity for potential change in entitlement spending or in tax reform? Where is the greatest opportunity to begin to drive out the debt and begin to achieve balance?
So I think the truth is, we have a spending problem and the great opportunities on the spending side because we do have a lot of evidence that we overspend, underspend, and misspend in health in a way that we're not getting the quality of outcomes that we could, and that's the starting point. And because Medicare is such a large payer of bills in the United States, all health reform really begins with Medicare reform. We can make Medicare a better program. It'll make healthcare in the United States a better, higher quality activity, and we won't spend as much. That's the great opportunity. I would argue that if you don't do the entitlement reforms, you may do tax reform and not be very beneficial. We need to grow as fast as we can. We have a very bad tax code. But if you don't do entitlement reform, you'll do tax reform, but you won't keep it. That's what happened the last time we did tax reform. 1986, do this big tax reform. But shortly thereafter, we start running what seemed like large deficits at the time. They seem sort of quaint at the moment, but I mean, we were very worried about them. And there were a whole series of, of laws passed to try to control deficits, and then ultimately a big summit to try to raise some revenue. And the minute you open up the tax code, good and bad things happen. And so the 86 reform unraveled relatively quickly, and it was because we had spending problems. And so you got to get them both.
So give us examples of Medicare reforms that actually achieve the transformative debt reduction you're talking about.
So there are two ends of the spectrum, right? So it's remarkable to think about it, but the first thing we do is just stop doing bad things, okay? So it was true that within the past decade, so we had this reimbursement policy that said that if something happened in a hospital or a doctor, a never event, something that should never happen, you know, you leave the scalpel inside Doug when you do his hip replacement, they got paid. It's only in the past decade that we stopped paying people for doing stuff that should never happen. There's still stuff like that. So we stopped doing never events, good idea. Now, when hospitals send someone home, they come back because the care was inappropriate and they don't get paid twice. Right? We cannot keep paying people for making mistakes. Right? Now we can push the boundary out a little bit further, and we can pay to keep, especially our oldest and most frail seniors, give them care in the home and keep them from going to hospitals, because usually when they show up, they both get sicker and way more expensive. So let's improve that. So there are a lot of things we can do to sort of extend the setting for care to a setting which most people prefer and actually ends up being cheaper. And we can also take advantage, for example, of the Medicare Advantage program, something that is not fee-for-service medicine where people get paid more for doing stuff, and which is highly valued by seniors who are in it, disproportionately serves our low income and different demographic groups, and also is different everywhere. So it's a great platform for experimentation and figure out really what is the high quality, cheap way to do this in the future. So we can push on both.
How do those reforms compare to the savings or reduction in costs from means testing or raising the age of eligibility? And then Tim, I'm going to come to you next.
I mean, raising the age of eligibility is a political hot button always. It doesn't.
Well, that's why Jim's next.
That's
going to be the next question.
It just doesn't get you anything.
Well, notwithstanding the politics, though, just sticking.
It doesn't. It is not where the money is.
It's not where the money is.
It's not where the money is.
Means testing?
It's where some of the money is. Affluent seniors should pay for
So it's really in the cost of health care. It's not in the age of eligibility. Jim, your perspective from the Budget Committee to the healthcare space to the political will to drive this.
Well, let me start by saying that we are not going to be able to reduce the amount of money we spend on healthcare. We're going to be able to control the rate of increase in spending. And you know what the problem is? The problem is us. It's our life expectancy. I think last time I checked, we're about 78 plus, and it's climbing, God willing, higher and higher every day. And if you look at Medicare, which is a budget buster, the last 2 months of life, and I went through this with my mom, it was dreadful, are very expensive because you fight to keep the people you love or yourself alive. And sometimes they're good decisions, sometimes they're not, but ultimately they're personal decisions. So if you like what Doug said about reducing costs by keeping people out of the hospital, and I did too, you like parts of the Affordable Care Act. Because parts of the Affordable Care Act were concepts that Republicans and Democrats agreed upon a long time ago. The problem is they just got cobbled into a bill that's very large and complicated that we're still digesting. But I think...
Which parts drove the cost out of?
If you run a hospital and you are discharging people and they are coming back on your doorstep because they weren't ready to leave or there wasn't appropriate follow-up, you're actually getting penalized under Medicare now. And that's one specific example, and there are hospitals that are making this work. This makes sense, it can save money, also keeps people healthy. Cancer, heart, and diabetes, 3 of the biggest disease drivers in terms of ruining people's lives and driving up the cost of health care. As we find ways through research, detection, early treatment on those 3 disease groups, that is another very significant benefit. Third example is what Doug said on managed care. With proper oversight, in a state which can be a laboratory for Medicaid, and Florida is trying this, and it's had good and bad results, Medicaid can be used to manage care and reduce cost.
Talk a little bit about Medicare Advantage and what that has done for the Medicare program.
Right. So Medicare Advantage is very good when you're healthy. They were offering dental care, eyeglass coverage, health clinic benefits. But when you're sick, watch out. And that's why it's important that seniors have choice, because Medicare Advantage takes the profits they make from people being healthy and they put it back into encourage them to stay healthy. So Medicare Advantage had a very significant subsidy. The government has trimmed that back. It still seems to be hanging in there. It's very popular in Florida among Democrats and Republicans, and I think it is a tool in the toolbox.
Josh, question from the audience. Can we create a budget that does not increase the debt annually? And I would add personally a note of that, maybe to include in that the impact of economic growth.
I think it is possible to think of the federal budget not adding to the debt, but that would mean the budget would have to be balanced.
So we had a surplus, we last had a surplus when?
2000 was the last year we had a surplus. That was the third year of surpluses, the late 90s.
So that would have been, in terms of the question from the audience, that would have achieved an annual budget process that did not add to the debt that year.
Yeah,
Was economic growth?
So I was going to say that wasn't that long ago. It was actually a bipartisan balanced budget plan that got us there, and we had a combination of a bunch of things. You had strong economic growth, you had some tax increases and some spending cuts that combined to get us to that point. So politically, it has been possible. The thing that is really difficult looking to the future right now is that because you have a population that's getting older, that means you basically have more retirees getting benefits from Social Security and Medicare, and you're leaving less workers in the workforce paying taxes to support those programs. So there's a simple ratio problem, and that ratio problem is something that's mathematically easy to solve. You either raise taxes on the people left in the workforce, or you cut benefits for the people now eligible to receive them. But politically and really socially, that is a difficult proposition. That's where you start having really hard choices politically. So, and I know this might be hard to hear, we don't actually need to get to a balanced budget. There is nothing economically magical for at least the government. Your personal finances, it might be different, but for the government, because, as I said, we're a very safe investment, we can actually run small deficits, and you can do so with economic growth that is going to lower the total impact of the debt on your overall finances. Because if you imagine in your own life, and let's say you make $50,000 a year, and you have a car payment of about $200 a month, if your income starts going up and that car payment stays the same, all of a sudden you're in a much better economic position. And it's the same thing with the federal budget. If our economy grows more quickly than our deficits or our debt is growing, we begin to get in a better and better financial position over the long term. And so that doesn't mean there aren't still very hard choices to make. It just means that shooting for every year to get that exactly balanced in a country as large as ours with an economy that fluctuates even by little percentage points has a huge important difference on the overall federal budget result, that's making things harder than they really need to be.
Some have said that we will only achieve annual balanced budgets in periods of remarkable economic growth that drives revenue. Take the .com period, and Jim, maybe you were on the budget committee during that time. Is that the salve sometimes for what ails us on the budget side?
I mean, in the past, that's certainly been the case.
Okay. A question from the audience, maybe for you, Doug. Josh alluded to this. What effect will the retiring baby boomers have on the debt in our economy?
The retirement of the baby boom generation drives the increase in spending in all these programs. So certainly in Social Security, right, starting to collect Social Security, Medicare, 10,000 new beneficiaries every day. We already had a gap of $300 billion between premiums and payroll taxes coming in, Medicare spending going out. So that's a program that's just driving red ink right now. It's going to get bigger. It's an unmistakable pressure on the federal budget. And as Josh mentioned, it has big economic consequences. When they depart the labor force, they're not being replaced one for one. We have fewer workers out there. So it is the most fundamental transformation of the United States. In every way, the old saying that demography is destiny is true. It's driving everything that's going on right now.
Can I add something real quick?
Sure, of course.
Just to give you some insight. When I give this talk, not in Florida, my biggest laugh line is always that I grew up in Florida, right down the street, and I always say that we were teased for being God's waiting room, for having so many retirees and elderly people, and everyone always laughs. And then I say, now, when the baby boom generation retires, retires, the entire country is going to have the same demographic makeup that Florida had when I was growing up. And so that has incredible impact on these budgetary programs.
Very good. Next question, Mr. Davis, and for those screening questions or those who've yet to submit, we're moving more quickly through these, so if there are more questions to come, please do share them. Mr. Davis, budget reform is one of the most partisan issues in Congress, partially the reason why progress on this issue is minimum. How do you recommend making the budget a nonpartisan issue to allow far more constructive improvements?
Well, you first have to get people on the same set of facts, and on a good day, Congress will do that. The Concord Coalition, the Fix the Debt group, other groups these gentlemen involved with have attempted to do that. They're going to Iowa and New Hampshire. The one thing Doug said that I would take a little bit issue with was that the next candidate for president have to address this issue. They should address it. It will be easy to ignore if the economy starts cooking again because it gets shoved to the back burner. This is not a short-term issue. It's more of a long-term issue. So, I think there was some middle ground last year. I think the Speaker of the House, John Boehner, and the President were sitting in a room during the fiscal cliff debates, during the shutdown, and I think they came reasonably close to making a deal. And I think on the table, on the Democratic side, was to change what's called the Chained Cpi, which is the cost of living increase. And those of you that are on Social Security sure heck know what that is. And it was on the table, and it would have been unpopular. It would have been a bit of a saver, and it would have been a huge icebreaker. So I think you need to get the right leaders in both parties back to the table, working off the same set of facts, and everybody, and that includes us, Democrats and Republicans, are going to have to give up something to get us started on that course. And then you take a baby step on that, and then you build on that baby step.
Next question is a bit of a technical question. Do you think GDP is an outdated method for setting economic policy? Do you believe a transition to a new metric like GPI, Genuine Progress Indicator, is a better way to gauge economic and social progress? Anyone on the panel?
I'm a fan of sticking with the GDP measure, improving it. We actually don't measure our economy very well. It's one of the places, quite frankly, we could spend more money and actually get better data that would improve the decision-making, in my view. But it should be supplemented regularly with things like GPI and other. And the Department of Commerce actually has initiatives to build so-called satellite accounts that allow you to get different looks at what's going on in our economy and not just measure this value of production.
Very good. What is being done to control fraud and waste in the federal budget, i.e. Medicare fraud, Social Security fraud, federal agency waste of resource and contracts excessively over original bids? And I would add to that perhaps a perspective on how much that might contribute to deficit reduction or bringing spending in line. Jim, you want to talk about it from your experience?
Okay, South Florida is considered the capital of the country. There was a fellow who was arrested for fraud on durable medical equipment, and he'd been a convicted drug smuggler, and he said, I got into this field because it was more profitable and less risky. And that story was told to me by Lawton Childs when he was the governor. So we all don't like bureaucracy and tax dollars to stay in Washington for overhead. And so people like to brag about the fact that there's a 2%, I think, administrative cost associated with Medicare. Well, guess what? When you don't pay that much attention, people take advantage. One of the laws that Congressman Jolly works on is called the False Claims Act. It's used against people that defraud the federal government. Remember which president signed that law? President Lincoln signed it because people were defrauding the United States military. So it is a time-honored tradition to defraud the government. Unfortunately, you have to be jealously protective. You have to have tools in your toolbox. There's technology. There are things you can use that Florida has done to reduce cost. People can get a whistleblower, financial incentives, but it is a problem, and we do need to get better and smarter, and it really undermines confidence in spending for places the money should go.
The impact, though, on revenue and spending, because I think this is similar to the question on foreign assistance pretty often. What's the perspective? What are we talking about? If
you fixed all of the problems, you would fix something that might look like $300 billion a year. So you might fix the gap in Medicare right now. Okay. But you'd still have a deficit as far as the
But that's a big number, 300 million.
There is no reason why we should accept some of the things that go on. I mean, if my mother lives in Jacksonville, and I went to visit her and I bought her a big screen TV at a Best Buy, and in 30 seconds, I have a text on my phone that says, your credit card is not being used in Virginia where you live, it's being used in Florida at an electronics store, is that okay? And I said, yes. If you buy 15 wheelchairs, you never get a text that says, do you really need another wheelchair?
All right, Dr. Gordon. For Dr. Gordon, in regards to investment of public revenue, what is the multiplier effect, i.e. return on revenue, of our investments of social safety nets versus defense spending?
Ooh, that's a tricky one. Doug might have some more input as well. I mean, I think whatever the specific multiplier effect, and it depends actually on what the state of the economy is at the time and what that defense money, for instance, is being spent on versus what the social safety net is being spent on. In a recession, social safety net spending has very high multipliers relative to pretty much any other spending, because you're putting money directly in the hands of people that are going to spend it immediately. When the economy isn't in recession and is growing very rapidly, spending on investments probably has a higher multiplier. So I'm not going to be able to give you a specific number of the multiplier. Doug might have done it when he was an economics undergrad or something. But I think generally that's the way to think about it.
That's the right answer. The number will differ by the state of the economy. It's going to differ across programs and investments.
Let me ask you a question on the defense side. Both an opinion from the budget shop side and also, Jim, your perspective on the use of OCO or overseas contingency operations. So for the audience, OCO is, some who criticize it would use the term slush fund, essentially off the balance sheet emergency funding, if you will, to pay for it. It grew out of the wartime needs, but it has arguably become a bit of a political savior to get through some of these harder times on the discretionary side, including last year. I believe some of the Army's operations budget actually came out of OCO, and it was not emergency spending. There's a political issue here about whether or not we keep OCO. What's your perspective? One from the budget shop. Well, let's start with Jim. Your perspective, having been on the budget committee, of the use of OCO, and then let's go to the budget.
This is a very good question, because actually the Congress was debating this week. It's the fiscal hawks against the deficit hawks. And it was principally in the Republican caucus, but many Democrats were and should have been paying attention to this balance. It is an example of the good debt, bad debt situation. And historically, we have paid for wars as we go. That was not the case with the Iraqi war. We charged it on the credit card. That's like charging the vacation. I'm certainly not saying Iraq was a vacation. It wasn't when I was there talking to the troops or Congressman Young. But that was an example of something that I think we should have paid for as we go. So this is another example of that issue that was debated in Washington. I think that when you're dealing with major conflicts, you should pay as you go, but there's always the unforeseeable. And so I think this contingency fund does have merit. And it's worth noting that our military today, Congressman Jolly's more up to speed on the stat than I am, is larger and more powerful than the next 25 put together, regardless of how you measure it. Technology, but certainly if you measure it by cost. And so we are having to bear the burden for the world right now. And, you know, whether it's Iran or the Middle East or China, it is a responsibility that we have right now, and it's a very expensive responsibility.
And then from a kind of a budget watchdog perspective, using these emergency funding vehicles to just fund regular defense spending is really just, it's a political escape valve, because Congress has put in place these very tough caps on discretionary spending, both defense and non-defense, probably tougher than they can actually write appropriations bills to get under.
And this funding falls outside the caps.
Yeah, and the emergency funding falls outside the cap, so it allows you to kind of backfill the defense money that you would rather be spending but don't have the ability to make the political choices in your appropriations bill to find room for. And I think that this is it's very simple, really. If Congress wants to spend a lot less on defense spending, they should spend less on defense spending. If they don't want to spend less on defense spending, they should make room in the budget to spend more. And just moving things from one account where it's a little harder to spend that money to another, it just doesn't make very much sense. And it doesn't mean they're spending less on defense. It just means that they're finding a way to not have to deal with the budgetary trade-offs that they've set up for themselves.
Doug?
I'm painfully aware of this issue. Part of my resume is I was the Director of Domestic and Economic Policy for the McCain presidential campaign, and John is blissfully unaware I've left the payroll, so he calls me all the time. And, he wants to spend more on defense, regardless of what we might think the merits are. He's there, and he wants a lot more. And I explained to him that there are these caps, and that even if they passed an appropriations bill that went above the cap, that they would just take the money back. And he started screaming at me, "Why do you do this to me?" And I said, "John, I didn't do it, John." It's that's the defense hawks really upset with the fiscal hawks. The problem with the OCO thing, from a defense point of view, is not all dollars are created equal. Yeah, you get around the budget restrictions, but you can't use the money in the best way from a defense point of view.
Sure.
You can't make investments in the right strategic capabilities. You can't get readiness. I mean, only one of every 3 battalions in the United States right now is combat ready. I mean, so we have people on paper in our military, but we're not ready to use them. So getting it back in the defense budget is the right way to do this. And from all the charts, the right way to fix the problem is spend more on defense, spend less in the mandatory programs, and just every year.
And this OCO fund, it's kind of malleable because it's who determines it's an emergency. And I believe one of the services last year, for instance, requested the purchase of about 16 Blackhawks. Congress said, no, that's not an emergency, but yet found a way to use it for other operations.
In the spirit of fairness, that is not uniquely a defense phenomenon. The 2000 census was declared an emergency.
Right. Very
Just saying.
Next question, and this goes to that as well because it brings in this OCO account. Discretionary spending is falling to record low levels, but that is a percentage of funds, percentage of GDP. Are actual dollar amounts for discretionary spending growing? So do we have more money for discretionary spending than ever before?
I mean, I think that's true, although some of the caps have actually lowered real spending dollars, which is very unique, probably the only time in the history of budgeting that's happened in this country. But if you have inflation growing, or you have population growing along with inflation, even keeping the same amount of money, it has the same effect as if you were cutting it. And I describe this when we have a budget exercise where people have to make trade-offs, and if you just think of education dollars, if you get $10 billion to your state for education, but the amount of students grows and inflation grows, so teacher salaries go up and the books and supplies go up, even if you're keeping the amount of the dollar amount the same, it's being cut because you have more students and more expensive supplies. So that's the same thing with these discretionary spending accounts, that at a minimum, we've always assumed that discretionary spending would keep pace with inflation. And there are actually a lot of spending programs where you would want spending to actually keep pace with economic growth, which grows more quickly than inflation. And so when we budgeteers look at it and see it growing slower than that, people always criticize us for saying, well, it's still growing, it's just not growing as fast. How do you consider that a cut? Because you have to kind of project out in the future how much equivalent spending would be 10 years from now if you take into account population growth and inflation and economic growth. And relative to those levels, we are cutting it pretty dramatically.
Got it. Do you have a comment?
A couple of points, thank you. And we're talking about non-entitlement. There are certain areas we're going to have to spend money that if you don't want to spend money, think about what you believe about these specifics. One is, General Eisenhower had a great idea to build the interstate highway, I think. but that's kind of aged and it's falling apart, and it has to be reconstructed. That's expensive. Huge issue for the Congress right now on the gas tax. Nobody's increasing the gas tax. But Florida, this is one of the least of our difficulties. We're not nearly as aged as parts of the country that many of y'all came from or still have family. Also, we're growing. And when you grow, you've got to have infrastructure there to meet the needs, certainly for our quality of life. And the last example, and the most painful example, is the human cost associated with these armed conflicts. We've been talking about defense. The veterans budget is outside the defense budget. And we do not do the job that we should be doing for our veterans and their families. And Congressman Jolly's been a leader on this. The safety net is there for a reason. It impacts Medicaid, it impacts Medicare, it impacts Social Security disability, it impacts entitlement in terms of military pension and disability, and that even doesn't cover all of it. And as Doug mentioned, we have worn out a lot of our troops and families with these extended deployments. And so that's another example where we still are going to be paying the price.
So Jim, then a follow-up for you, a question from the audience. How would you propose addressing entitlement programs without eliminating the safety net for many of our most disadvantaged citizens?
Right. Well, I tried to talk a little bit about that earlier. I'd like to cite Doug, because I don't expect he's a fan of the Affordable Care Act, and it's got lots of problems that I mentioned. The key is, if you don't like it, what's the alternative? And that's the debate in Washington. But he did cite some sections that I think the Bush administration supported that deal with trying to use some market-type solutions and some regulation to reduce costs. Somebody that shouldn't come back to the hospital, and the hospital's penalized for that. We talked a little bit about managed care, and I'll just say again, I think those three chronic disease groups, diabetes, heart, and cancer, when you find ways to make strides in those three areas or help people do so, you deal with three of the biggest cost drivers in terms of healthcare, both public and private.
All right, Doug, a chance to not respond to Jim, but a question from the audience that'll give you a chance to add your thoughts on this. Wouldn't costs of Medicare decrease with universal care run by government versus for-profit corporations?
No. The appeal of single payer is just on paper. The reality will always be that in the end, you will have to negotiate with a hospital in St. Petersburg or a hospital in Tampa, or a hospital in Ames, Iowa, and there's no particular extra leverage you get by sitting in the Health and Human Services in Washington and doing that negotiation. Someone in the area can negotiate just as well. And so I've always thought that the single payer thing was illusory. If you want to control costs, you need effective negotiations so that you get the prices as low as possible. You have to have quality standards on the outcomes. And the question is, how do you infuse a system with those kinds of incentives? The reason I like managed care is that they have exactly those incentives. They work in particular areas, and they have to do the negotiations, put together the kinds of doctors and hospitals their folks can see, and they're not all super good. And that means that the bad ones go away and the good ones survive. You go to single payer, you roll the dice, you have one bed. I'm not a big fan of that.
Other perspectives on that question?
Agree.
No. Next question is, well, okay, so let's evolve from that question. Are there existing country models which could help guide us in entitlement reform?
Start, I guess. I think there are two models that I think of a lot. The first is on the healthcare. I look at basically every other country in the developed world and see spending much lower than ours on a per-person basis, and healthcare outcomes at about the same, or some cases even better. So in some sense, we are doing a lot inefficiently in our healthcare system that we don't see in other countries. Now that sounds very pessimistic, and my dad's a doctor. I know doctors are very good here in the United States, but what we have is a very inefficient system, and this is actually why I'm very optimistic in answer to that other question about can you reduce Medicare spending without harming our health? And I think the answer is clearly you can, because we're spending a lot of more money than everyone else and not doing any worse or or any better. We're at the same level. So there's a lot of opportunity to reform Medicare that can actually improve our health, because we can have better coordinated health care and spend less money. And so that's something to be very optimistic about. And then the other country I think about is Japan, who went through this aging of the population before we did. They're pretty much through it, and we're still approaching a population that's much older, people getting Social Security benefits, less workers in the workforce paying it. And what Japan had to do was they actually had to cut benefits on their Social Security program to people currently on Social Security. And that is something that I think everyone in the United States wants to avoid. I've read a bunch of bipartisan plans to reform Social Security, and not a single one of them cuts benefits to people currently on Social Security. So I again see this as a lesson that the sooner we act to reform a program like Social Security, the better off we all are. Because the sooner we act, the slower we can phase in these reforms. We won't have to cut benefits for people receiving Social Security at the time. We give people more time to plan for their retirement, knowing what the Social Security system will be for them when they retire. And if we keep waiting on Social Security, you get to a point where you basically have to cut benefits for people either right near retirement or people already in retirement. And I think that's something we want to avoid.
Question, and we'll conclude with this, your thoughts on a balanced budget amendment, and I will ask the panel this question because this will be the poll question we will ask at the conclusion, so I figured I'd give the three of you all an opportunity to tell us where you stand on a balanced budget amendment, pros, cons, merits, and otherwise. Jim, we'll start with you.
This is a tough one. I think I voted for some balanced budget amendments in Congress, but I think the problem is there are going to be things that happen, and you have to, it's the good debt, bad debt. 9/11 is an example of that. The costs from a security standpoint, domestically and international, are huge and obviously totally unexpected. A recession, the government is there to keep a recession from turning into a depression. And natural disasters are a small example, but there have been years where the totality of natural disasters, we haven't had a hurricane here in so long, it's hard to imagine, but other parts of the country, Congressman Jolly knows this, there's constantly, it's floods, it's earthquakes and fires. And so I think the Congress does need some discipline in terms of dealing with these long-term issues, but I think we have to recognize the government also has to be prepared to deal with the unexpected.
I mean, the only benefit of a balanced budget amendment is rhetorical. And it's basically saying this is a horrible economic policy to have a balanced budget amendment because it allows no flexibility for war or emergencies. It's not great economic policy because we don't actually need to balance the budget every year to have a growing economy and a lower debt as a whole. But even though it's bad policy, we just don't trust our politicians enough to actually be fiscally responsible, and so we need an amendment in the Constitution basically forcing that upon them. But I have a more optimistic view of our politicians, believe it or not. I think that they have it in their power to balance the budget when they want to have responsible fiscal policy when they want to, and I've seen it happen in the late 1990s. The Republicans and Democrats agreed on fiscal policy. In the early 1990s, they had a budget agreement. In 1983, Republicans and Democrats reformed Social Security, and they did that all without adding this thing to the Constitution. And so I think it's probably unnecessary. I think we can get our members of Congress and the President to agree to make changes without having a very difficult and unworkable amendment to the Constitution.
Doug?
So I have a PhD in economics, and part of the training is to train all common sense out of you, and as a result, oppose balancing the budget. I think we should have a balanced budget amendment. I do. The ones that I've seen have been designed to allow for the accommodation of war and other extraordinary circumstances. There's an out clause that's fairly easy to put in there. The advantage of doing that is that there is no rule that a Congress can impose on itself that a future Congress can't just waive. So you look at what we're doing right now. We have these caps on defense and non-defense spending, which are essentially promises that honest really will never spend any more than that. We would never lie to you. And when we hit the caps, they're going to go past it. Unless there's something above the Congress, above the president, constitutionally that disciplines them, it's just not going to work. And the balanced budget amendment has the advantage that it's very transparent. The budget balances or doesn't. Everyone in this audience will know. It's something people understand, so it has to be supported at the grassroots level for people to adopt it. And I think adopting something like this would be beneficial in the United States. And we've seen this around the globe. The other kinds of rules have been put in place, balanced budgets and others, and it's benefited those countries enormously. And so I have come to the conclusion that all these objections notwithstanding, this would be a step in the right direction.
Very good. This topic is one of the great challenges I think we face. I mean, personally, I've often said it is a matter of national security, ultimately, how we handle the long-term growth of the budget. Just in conclusion, and very briefly, are there any parting thoughts either on what needs to change or where we need to find the political will, or are we on the right path? Any thoughts? We have a most distinguished panel. Any last thoughts before we break?
I just think it's good you do this. I hope you keep doing it. It's very important to have a mixed audience here.
Good. Josh?
And I would say we are working during the primaries for the 2016 election in Iowa and New Hampshire, but Florida is going to be a pretty important state for the presidential election, and it's up to you to make your candidates say what they would do with their budget.
So when you say the Concord Coalition is working in those states, what do you mean by that?
The Concord Coalition is partnering with a group called Fix the Debt, and we have citizen cabinets in Iowa and New Hampshire, and the goal is to have those citizen cabinets get people to the primary events that the presidential candidates will be attending, and making sure they're asked a question about the budget, because there is going to be a temptation to avoid specifics, to avoid talking about it, because again, it involves hard choices. And we're going to be there to make sure those candidates do talk about the hard choices, do talk about what their first budget would look like, because within 3 months of taking office, they're going to have to present their budget plan for the next 10 years of the country. And it's important to know what they're going to do before they're elected, and kind of pick our candidates based on their answers to those questions. So that's what we're doing.
Doug?
And I would say, thank you for coming today and showing this interest. I would encourage you to do what Congressman Davis said. Put a face on this. Budget geeks like me want the lines to match up, and that's not really what's at stake. What's at stake is the quality of life for this and the next generations, how safe we will be as a nation, and our ability to honor the promise that every generation will be more affluent and more secure than the previous one. That's at risk now in a way that it has never been before, and that's what should be talked about.
And this is an issue that I promised I wasn't going to make any statements, only ask questions, but this came up recently, and from the perspective I now sit, I will tell you, we have the government we elect, and all of these very hard decisions have to be made from the ground up, because when folks reach out and try to solve this issue, it is too easy sometimes to get whacked back down, because if we can't reach consensus and compromise somewhere at the community level, we'll never reach it in the Congress, because we will never have the political will in the Congress, in my opinion, to do so. Folks, this is a conclusion. Please don't get up yet. We got a couple things. First, let's thank the distinguished panel that joined us for the budget. We do have the poll question that just came up. Looks pretty evenly split. You all did a good job at obfuscating where we should go on this one. I believe Dr. Oliver is going to provide us directions on the lunch. Please join us for the lunch with Admiral Kirby. It will be a special experience. Dr. Oliver, I'll let you tell us what we do next.
Thank you, Brad.